Well, hello and welcome again to another Thursday Live. I am Jerry Dreessen, the Executive Director here at the Association of PEMF Professionals, and we are here to help anybody that is in the process of owning a business, working with small animals, large animals, humans that involve PEMF and best practices. We do certification of anybody that's interested in those as well. We started this process, it's going to be probably 20 years ago, was the initial brainstorm of creating what you are seeing now. So today, what we want to talk about, let me bring that up a little bit bigger for you there. There we go. So introducing the AOPP and the professional standards, what we are all about, because as you know, PEMF is now making huge headway in acceptance, people using it all over the place. Some people are wondering, what is this all about? How do you know how to use this? Being in business, things like that. So our goal is to equip you with certification, to equip you with all of the information and that you can use. And so just a quick shout out. Hello, Ontario. Yes. Thank you for checking it out. And again, if we're missing anything, let us know, because we definitely want to include that in what we're doing too. So with that, let us move forward. So today, who is this for? Like I mentioned, anybody that does PEMF, as far as practitioners, human, animal, industry stakeholders, anyone seeking responsible PEMF understanding. So we even have people that are certified and they just use it on themselves at home or on their animals on their farm. So Sheridan, Wyoming. Hey, we got inundated last week with Pennsylvania. So it looks like we've got we're doing pretty good so far. Maybe we'll see here at the end of the broadcast how many reach outs we've had from people. So anyways, the reality again, as you know, the industry is just taken off. We've kind of reached what we call the hockey stick. So there's just this little amount and then bam, it just takes off. So you are now seeing that. And if you've been part of our organization, you are definitely positioned to handle this huge amount of knowledge that's going on. And again, people are going from what is that to I've heard about that. So let's see here. Just a quick shout out to Barbara. Hi, welcome aboard. And again, the reality is evolving regulations, and our goal is to take standard regulations and have that be part of what the states are now, going through, and like on the vet boards, adding PEMF. It's now part of what they need to add, but then also help them with that. And so those are some things going on. Lauren, our vice president, she is, traveling and talking to these boards face to face and one-on-one. And Leslie, yes, that's where we had, I believe Lauren met with them. I'm trying to think of online on that, but I know she's also traveling to Texas too. So, and also that's a good point too, Leslie, is if there's a vet board that's meeting, let us know so that we can be a part of that, because we're not able to keep our finger on the pulse of what's happening to all 50 states, and not only all 50 states, but internationally too. So up in Canada and the other 18 countries that we're part of. So today's focus is introducing the AOPP Professional Standards. This is a kind of a summary compilation, so you'll be able to see a lot more inside our members area, but the professional standards, why they matters, the core issues. And that there's no central definition of good practice. What is good practices? Being able to create that. So sometimes there's practitioner confusion as far as, well, what does this machine do? Being able to have a standard answer that complies with we talked about this in previous ones, but your lane. Are you a vet? You've got your lane. Are you a non-medical PEMF practitioner? You've got a lane. Are you a medical professional, whether it's a naturopath or chiropractor or physical therapist? Again, we all have our lanes in there. So as far as what we can talk about, whether we're doing sessions or whether we're doing treatments. So again, having that regulated and being able to provide that to a board when they're saying, okay, well, who are you? What do you do? It's like, well, we'll provide you the language. We've already got it figured out. You just have to look at it, approve it, and pass it. You can spend some time debating it, but at least they have something to debate versus creating something out of thin air. So that's part of our process. And again, your membership, your dues that you pay us help us afford to be able to do those things too. So we're really excited to be able to get out there and do that. And I don't think there's much public skepticism anymore. Before there used to be, but there's so much research that's out there. Even on our website, we've got a place where people can go and look at the research. If you're a non-member, it limits you to just looking at 3 articles. But if you're a member, then you can do once you're logged in, you can do a major search on keywords and find out what's going on. So again, strong professions require a defined scope, clear expectations, shared language, and accountability. So you go from being fragmented to professional. You go from being misunderstood to being credible. And that's all about language, how we put it together. Again, research has a lot to do with that too. As far as based on this evidence here, we know that this can happen. Like we know that PEMF is good at improving the speed at which bone heals, and it can be put over the cast. And so, that's one thing. It does helps with bladder incontinence. It helps with PTSD. So we've got research that shows that proves that. It's not just our organization saying that, or somebody with a PEMF device saying, hey, I think this might help. Let's try it. Now you've got a proven record. You've got a pedigree. You've got a lot of power by having the AOPP on your side and being certified, because then you can just, you can brand us with your brand. And a lot of people are doing that. What the standards include. So again, scope of practice for non-diagnostic PEMF, core competencies, safety principles and contraindications. If somebody's, again, like we talk about, somebody's got a pacemaker, if they got, cochlear implant, or they've got a insulin pump implant or a TENS unit implant, those kinds of things, there's a checklist, and we provide that checklist. So that's part of the standards of care. Documentation standards. So, we talk about the SOAP charts, subjective, objective, action, and prognosis, or like when you're going to see them next and why. So, you can, as a non-medical person, use medical terminology to put your charts together, because that is what's going to really help you out and help us out in reaching out to these, to the states that are putting these together. Anybody that's certified through the AOPP standards of care, they're charting things, they're writing things down, they're keeping notes, they've got a pre-treatment or a pre-session and post-session, verbiage that they use, all of those things. And the more that we can display that we have that, the better off we'll be as these boards are trying to figure out what to put in their bylaws and then pass them. Again, informed consent and communication, referral and escalation guidelines, advertising and claims standards, human versus animal, distinctions going on in there, and then built for real world PEMF practice. So what's that look like? How many clients can you have? For you, are you a brick and mortar? Do people come to you, or are you mobile? Do you go to them, or are you a hybrid where you do both? Those are different business models, and all of them are good. It just depends on, what works best for you. I know here in the Northwest, there was a franchise that was called, I just blanked out. It had to do with the word pulse. Dang, I just blanked out. Pulse centers. There we go. And so people would go as a brick and mortar. There were like 10 PEMF devices. People would sit in a chair, as like a round room. People would sit down as either, a pad or, what they needed. And it just started going, and then COVID hit. And these businesses that just spent a bunch of money trying to build these out, these, franchise, they closed up. They had to close everything up. And I think it might be happening again. Pulse centers, you probably have one near you or something similar to that, which again is a great business model. Back then, even just before COVID, people were still wondering about PEMF, but here we are, 2026, and a lot more people know about it. So again, it's a great model. It's a great franchise model for those of you that are interested, maybe doing something like that. And then again, your scope and boundaries, and I think it's the key highlight, but what practitioners can do versus what they can't do. Say versus say. So again, clear boundaries is not diagnosing, not prescribing, and not practicing medicine. Those are the key things. Kate had something she wanted to drop in here. The portion concerning PEMF was removed from the meeting agenda. It's to be set and discussed in July, which is good. People are, they want to make sure that they do it right, because it's really tough to pull something out once it's been put in. You can go in and you can like change some wording, but for the most part, once it's been in, looked at, and approved, I think you have to have a higher percentage of members to like pull it out. So that's good for them that they want to continue to discuss those things. But again, practicing medicine without a license is that's a pretty harsh fine, and that only happens when somebody that is not a medical doctor or a physician that has the ability to prescribe, diagnose, and treat starts doing that. So we all know if there's a cut, we say it's a cut. We all know that, hydrogen peroxide or Neosporin or something on the cut, if it's so wide, so big, it needs stitches. We all know that. But if you walk in and you say, oh my gosh, that's a class 3 cut, we need to get some stitches in that. And it's like, well, who are you? Well, I'm your next door neighbor. And it's, versus I'm a field doctor, or I'm an ER nurse, or, those kinds of things. It changes it. So again, and I harp on this all the time, but it's not that you're doing it on purpose. It's the times that you say something on accident within earshot of somebody who's ready to pounce on you. So keep everything, keep your language to the lane that you're in. So again, all of that, what it does is it protects the practitioner, it protects the client, but also it protects our profession. And it establishes a safe, ethical operating limits. And then here's a really good question I want to bring up. So what are my thoughts on people using words like treat or treatment, heal, healing when advertising, especially when they are not licensed? So, and again, the people that do that, they're the ones that are going to get nailed. And it's because of that language. And it's not us, it's not the language, it's the people that discern what that language means. So if there are advertising boards or people that look at it and you're saying treatment or healing, healed, it's how do you know it's healed, right? What techniques are you using to determine whether it's healed? Are you taking x-rays to know that the bone is healed? Are you doing a sed rate, blood draw to show that it's healed? And again, you can always, I think you can always say, for example, if it's healing, well, what we want to do is run some sessions, and then I'd like you to go to your vet and have them take a look and see how it is going, whether the area in their view has been healed. So, I mean, that's how you can get away with that. But if you say PEMF treats vascular disease and will heal it within 3 weeks, now you're setting yourself up. How do you know any of that, right? If you're not a professional. So yes, you have to be very careful. And if you see somebody that's doing that advertisement, and they're not a professional, you can, in my opinion, just give them a friendly call and say, hey, I saw your ad. I know that the state might be coming down on non medical professionals that are using this language, and you could be setting yourself up for a cease and desist, or worst case scenario, a lawsuit. But that's usually what they do, is they'll take you to a place to be fined, right? To get your hand slapped or wrist slapped, or it hasn't happened enough to really know what the problems can be, but it will cause the vet board to make sure that non-professionals can't use PEMF because they're out there saying and doing stuff that's outside their lane. And so that's really what this helps us with, is getting the right verbiage in there. But also, we're trying to get them to say it's okay for people to use PEMF that are non-medical, as long as they are certified by a national organization like the AOPP. That would be great. We'd love to have that in everything, because it lets them know that people that are using it are compliant under the certifications that we have. And our certifications are written so that, doctors and vets, they agree with the process and they're really happy. In fact, they've been able to take a look at it and approve it too. So that's part of why we do what we do as well. Keeps jumping back in. And again, what we're doing right now sets us up to win in the future with these boards that are doing things. Oh yeah, Sarah is talking about the Oklahoma board. And that's, again, it's interesting now because we've come a long ways. Now we're talking about, boards meeting and getting involved and things like that. So we're definitely taking a little bit of a pendulum swing to be part of that. But again, that's why we're even doing this broadcast, is so that people that don't know anything about us or PEMF can see what we're all about, and that we are trying to get the best practices out there so that everybody is covered. So the regulatory landscape and the risk, again, can be complaint driven. So there could be somebody that complains to the board because they saw a massage therapist using PEMF on somebody and said, yeah, this will treat your muscle pain. And the person's like, how can they say that? And so it's, I think it's overinflated, because the person saying that should actually go to the person saying, what do you mean by that? Versus like getting so incensed that they have to call somebody to complain. But again, if we're already there and it's like, well, that is a person, had they been certified or gone through certification and used the right language, it never would have happened, in my opinion. And so that would be the reason to get the certification. But again, people are looking. There's people out there looking at website language, and that alone can trigger an investigation. You can get a call by the veterinary board of the state that you're in saying, hey, we took a look at your website. We want to know why you're saying that you treat blank when you're not a physician. And it's like, whoops, I need to take that down, and again, anytime that we are out there doing things and the board, whether it's a medical board, chiropractic board, veterinary board, if somebody comes to them with a complaint or they're seeing this, the easiest thing to do on their world is just to do a stroke saying nobody except for these people can do this now, because you guys are causing us phone calls and complaints. We don't want that. So it's easier for us to say you don't get to do it anymore, versus taking some time to write language, or to say, well, you need to be certified. So, and again, that's what our job is trying to do that. And then without standards, if we don't define them, somebody's going to come in and define them for us. And that was our theme way back in the day. If we don't get in there and certify and regulate, then those who don't know anything about this are going to jump in and just do some really dumb things, as far as not allowing people to do this. And again, if somebody else is allowed to jump in there and say what's right and what's wrong, and they're doing it based on non-information, then we're in trouble. So again, that's what we want to do. So with standards, we demonstrate responsibility, enable self-regulation, and then also strengthen the advocacy. And I want to drop this in here. Lauren is jumping in. Hi, Lauren. So yeah, Nebraska met yesterday. They reiterated that they interpret PEMF to be veterinary medicine because it is an apparatus that is treating or preventing injury or disease. They suggest we pursue a 407 application to change the statute in Nebraska, which is what we're doing. And then there will be an update posted to the web later today. So check it out, and we'll discuss the full update next week on our live broadcast. So on our website, you can go and find out what's happening in all of these places. And you can go to the place that talks about Nebraska and see what's going on. So we're learning too. And Lauren just spent, she went through this process to learn how to do these types of things too. So, lobbying and, stuff that we knew was going to happen. But now we know that we need to be on top of that too. So again, big shout out to Lauren for, getting out there, learning the language and doing these talks, which is great. Member expectations. So for AOPP members, if you're not a member, this is what we hope to convey. And that, again, these are baseline expectations, not suggestions. So in practice, align your website language, avoid medical claims, stay within your scope, use informed consent, and then document your sessions. If you're not a medical physician or a vet, you need to use the word sessions, not use the word treatment. And then you won't have any problem at all. And then refer when appropriate. So as far as the clarification is that it does not override the state law, and it does not grant legal authority, and signals professionalism and alignment when you do that. So if you say, oh my gosh, yeah, we need to get a vet's eyes on this, or medical doctor's eyes on this, you can recognize a problem and refer out. That's not going to cause a problem. It's like, well, who are you to refer to a doctor? It's like, this is swollen. It's something that's outside my scope. You need to see a professional. I mean, everybody wins, right? So, and especially if the vet in your area is getting people coming to them saying, yeah, I was doing working with a PEMF person, and they saw this and they said that I need to see you. They're going, great. They're doing their job. They're knowing and recognizing when this is outside of what they're doing. Or, even working side by side with a vet is great too. I mean, if you can do that, that's the best, because they see you, you're working with them. They see the benefit of PEMF and that it's okay that you're doing it because you know what you're doing. And so having them be an advocate for us when it comes time to the board making decision, if they could go and speak or write a letter, those are some of the political things that we're going to be working on as well. So then how this helps practitioners. So again, it reduces the risk in the gray regulatory areas. It clarifies what is acceptable, strengthens legal defensibility, builds client trust, and differentiates from untrained providers. You'll get people that have a PEMF unit, have used it on themselves and had great results. So now they're, going around the neighborhood, or they're, asking people to come in, and they're making mistakes. If they're not certified, if the company that makes the PEMF device isn't training them, they can, again, place it on a shoulder of somebody that has a pacemaker and not even know that you're not supposed to do that, because they weren't trained properly by anyone. And they're just like, hey, try this. This will make your shoulder feel good. Or they'll put it on somebody that's on a ton of medication, and now their body's absorbing the medication at twice the rate, and they have an overdose. Those are all of the things that we cover in our certification courses, and why it's important to do that. But if you do that, and again, during your consultation, you ask those questions and you do that consistently, again, those are all things that are going to be looked on with like, wow, you guys are really doing, all the right things, which is great, because PEMF is a major device that, if done improperly, can cause damage for people that are, like I said, it's usually some sort of electronic thing or a medication thing, or they've got some sort of a deep wound. Again, we teach all of the rights and the wrongs. And if your company that you bought your PEMF device from isn't teaching you that, then you really need to come in and get certified. Even if you do just the basic, what is PEMF certification, which is of the 4 that we do for PEMF. Hey, Joanne jumped on. Hello, welcome. Glad to have you on. And we are just wrapping up. And then finally, supports long-term sustainability and professional credibility, which is, again, what we're all about. So the call to action, again, you can review our standards page, and that's our PEMFprofessionals.com/professional standards for PEMF practice. And then you can compare your current practice, and then update your website with that, client communication, documentation processes. And then, again, with the message that we want to convey is the standards are all about clarity, protection, and credibility. And our organization, the Association of PEMF Professionals, we want to be the beacon that defines responsible PEMF practice and what to do, so that we're a one-stop shop, and anybody that needs it can come to us to get it. And then all states, all countries recognize us as the organization that creates safety for people that are using this. So I guess that's the big idea right there. And Andrea. Hey, Andrea, thank you. You're welcome. We are, like I said, we're continuing to grow. And as the world of PEMF shifts back and forth, we're right in the center of that pendulum. So we are, like I said, getting out there, talking, educating, and endorsing. And we want to be your advocate for what you've got going on. So again, what we just got through talking about was professional standards, and we have a link for that. And thank you again for your time. Again, what you can do is if there's things that I'm talking about that you don't understand, or you've got knowledge on stuff that's going on, drop that into our questions and tips at info@PEMFprofessionals.com. If you're not a member and you have a PEMF business, you need to be a member. You need to be a member of this international organization that does certification, so that you carry with you that one piece of knowledge and property and skill sets, so that if somebody ever comes to you and says, who are you? Why are you doing this? What makes you different, or how do I know I could trust you? And then you can tell them, you've been certified through the AOPP, which is an international organization. Even if a board member on a vet board, says, well, what's the AOPP all about? They may not even know about us. And then it gives you an opportunity to educate them that we're here to help everybody. We love working with all of the different boards that are out there to let them know that we are doing everything to help them out too. So with that, I am going to end today, and just remember, like and share this. We've got blogs. We're on Facebook, Instagram, LinkedIn, YouTube, and I'm proud to be a member. And that's what we want all 20 million of you to say. I don't know how many people are using PEMF, but it's growing every week. So, and again, thank you very much. And I guess we'll see you next month, which is next week. So have a great rest of today, last day of April, and we'll see you again next week. Take care, and thanks again for tuning in and being a part of this. Take care.